Hi, everyone. Welcome to our session today. My name is Emily Singer Lucio, and I'm the ADA 504 Compliance Officer for the university.
Hi, everyone. I'm Tessa Cahill, and I'm the Director of the Accessibility and Disability Service Unit Department here on campus.
And we're here today to talk to you about disability compliance and accommodations. We wanted to share with you a little bit about what each of our offices do, the roles we play, and ways that we can coordinate with you and collaborate about accommodating students and helping them be successful at the University of Maryland. So the University of Maryland is committed to providing equal educational opportunities with full participation for all students with disabilities as required by the Americans with Disabilities Act and Section 504 of the Rehabilitation Act. It is the university's policy that no qualified student with a disability be excluded from participating in campus programs or benefiting from UMD activities. And that really includes everything from classes to extracurricular activities to other programs on campus. And so we always want to make sure that everything we are doing is accessible. So my role as the ADA 504 coordinator is to guide the university's efforts to move beyond compliance and towards seamless access. As the university's focal point for disability-related initiatives, the ADA 504 Coordinator's Office collaborates with university offices, government agencies, and advocacy groups to inform decision-making and ensure university compliance with state and federal mandates. The office addresses accessibility issues and reports of disability-based discrimination on campus. So essentially what I do, sort of like a bullet point, is I collaborate, as I said a minute ago, with university offices, government agencies, and advocacy groups regarding accessibility issues. And I really do work with everyone on campus, everyone from athletics to the general counsel's office to accessibility and disability services, to faculty, to staff, to the human resources, and everything in between. So it's really my responsibility to stay up to date with where we are in terms of access and help answer questions around campus as much as I can. I do consult with ADS and students and faculty to resolve disability-related concerns regarding student instructional accommodation requests. And I also review policies and procedures to ensure non-discrimination practices. So that would be every type of classroom policy, university policy, and everything that might impact somebody with a disability. Provide technical assistance and direction for university policies and in compliance with state and federal mandates. Provide support and guidance to professional and instructional staff through consultation and training. Address accessibility issues and reports of disability-based discrimination. And then, just so you know, where my office reports to, it reports to the Vice President for Diversity and Inclusion, Dr. Georgina Dodge. So I wanted to talk a little bit about what is a reasonable accommodation. In the context of higher education, I find it easier to define what is not reasonable and assume that if the accommodation needed does not clearly fall under these guidelines, it probably is reasonable. So if making the accommodation or allowing participation poses a direct threat to the health or safety of others, if making the accommodation means a substantial change in an essential element of the curriculum or a substantial alteration in the manner in which you provide your services, or if it poses an undue financial or administrative burden. Those are the three areas we look at when looking at reasonableness. I'm going to go from the bottom to the top. So it's very, very difficult to prove something poses an undue financial or administrative burden, especially given the size of its institution, because the courts would not look at the budget of a department per se, they would look at the budget of the entire institution. So for example, if your department was putting on a lecture series and it had a guest lecturer coming and someone wanted to attend who needed an interpreter, your department would be responsible for paying the cost of that interpreter. And that would just be an obligation under your department. And there really would be no way around that. So in regard to the second one, making a substantial change in an essential element of the curriculum, what I always recommend faculty do is really look carefully and have a good sense of what is absolutely essential. So for example, if we have a student with a physical disability who's taking a lab science class and they can't physically manipulate the equipment that's required for the experiment, for example, but they can analyze what they see, or they can make a hypothesis and a conclusion based on their results. that would be a question about, is that an essential element? Is it essential that they absolutely be able to manipulate the equipment, or is it essential that they be able to draw a conclusion based on the information they're looking at? Because there are ways that we can make equipment adaptable or provide accommodations to ensure that they have access to it. And then the other one is if it's a direct if it's a direct threat to the health or safety of others. And that's, something else we really need to look at carefully, but doesn't happen very often. So I mentioned about essential elements. So this is what I think is the most important takeaway for our faculty in terms of what I've been saying, which is that it's really important that you look at the essential elements of your course and your program objectives that are identified as the core learning outcomes, such as skills, knowledge, or licensure requirements that all students must demonstrate with. And the key thing here is with or without accommodations. Like I was just saying with that example with the microscope, for example, can the student demonstrate their knowledge of the skills with or without accommodations, right? So could we provide an accommodation so they can, if they can't physically manipulate the equipment, but they can get to the same outcome. So we want to look at, you want to make sure that you clearly articulate the overall purpose of the course and the program. You want to identify the required mastery of specific skills, knowledge, principles, and concepts. You want to convey the framework used to set academic and program standards and ensure a fair deliberation with qualified campus professionals when determining if a requested accommodation would be a fundamental alteration. If it is not reasonable to make a substantial change in an essential element of the course or a given student's curriculum, then it is the institution's responsibility to demonstrate that the change requested is substantial and that the element targeted is, oops, I didn't mean to do that, sorry. Element targeted for change is essential to the conduct of the course or curriculum. And so we'd have to work on that with our office to determine that's the case. Okay, so some questions for you to consider in terms of establishing essential requirements. What is the purpose of the course? What methods of instruction are absolutely necessary and why? Would altering the method of instruction compromise the purpose of the course? What outcomes are absolutely required for all students and why? What specific knowledge, principles, concepts, and skills do the faculty believe must be mastered by students? What methods of assessing student outcomes are absolutely necessary and why? So for example, if a student based on their disability requested an oral recorded essay exam, would this compromise the purpose of the course? And what are acceptable levels of performance on these student outcome measures? And faculty may need to consider how to evaluate the student outcome measures that have been accommodated or provided in alternative non-essential formats, such as an essay exam presented orally. Okay, so the other thing I wanted to talk about this morning or today, sorry, is I want to talk about service animals on campus. We're seeing more and more animals on campus, and I want to make sure everyone's clear on the distinction between a service animal and an emotional support animal. So a service animal is a guide dog individually trained to do work or perform tasks for the benefit of an individual with a disability, and it can be any breed of dog. It is usually always a dog, but in some cases, you may have heard that there are miniature horses that are allowed, but 99.9% of the time, it's going to be a dog. A service animal is not required to be licensed or certified by a state or local government or animal training program. That actually comes as a surprise to a lot of people. Service animals are allowed to accompany their handlers at all times and everywhere on campus, except in areas where specifically prohibited due to health, environmental, or safety hazards. For example, mechanical rooms, machine shops, and some laboratories. I don't want to say all, but some. The ADA does not require service animals to wear a vest, ID tag, or specific harness. The handler is also not required to carry a specific identification card for a service animal. Again, this actually comes as a surprise to a lot of people. So there's only two questions you can legally ask to confirm if it's a service animal. And that is the dog a service animal required because of a disability? That's the first question you can ask. The second question you can ask is what work or task has the dog been trained to perform? Individuals cannot ask about the person's disability, require medical documentation, require special identification card or training documentation for the dog, or ask that the dog demonstrate its ability to perform the work or task. Service animals are not required to be approved through any accommodation process. So I want to make sure that that is clear. Emotional support animals, on the other hand, is a very different situation. So an emotional support animal is an animal that provides comfort, reassurance, social interaction, or other emotional benefits. The animal does not have to be trained to provide comforting. An animal support comfort animal is not considered a service animal. The use of an animal, i.e. as a comfort or therapy animal, may be allowed as a reasonable accommodation through established accessibility and disability service procedures. So it has to go through an accommodation request process through ADS. There must be, for students, there must be an identifiable relationship between the disability and the assistance that the support animal provides the resident. And that, again, is for ADS to determine. An animal that provides affection and comfort and is specifically trained to be gentle and stable in stressful situations. A therapy animal is not considered a service animal. So the use of a therapy animal may be incorporated into the treatment process as prescribed by the appropriate healthcare professional. Support animals are not considered service animals under the ADA, and emotional support animals and therapy animals must go through an accommodation request process to be approved on campus, like I mentioned. And again, unfortunately or fortunately, they can be a wide variety of animals. That's not just limited to dogs. There are some restrictions in some states for certain types of animals, but overall, we have to really evaluate on a case-by-case basis. First of all, if the emotional support animal is necessary, and then there's a second layer where ADS gets to determine if the animal that is been asked to be that emotional support animal is an appropriate animal for that. So they can also make that determination too. So what does a service animal do? So to put it simply, a service dog is a dog with a job. And that's what's really the main distinction between a service animal and emotional support animal. A service dog has a task it has to perform. So the exact job the dog performs depends entirely on the disability they've been trained to assist with. So for example, for visually impaired individual, a service dog can guide them through crowds or around obstacles and stop at stairs and crossings. For those in a wheelchair, a service dog can help pull the wheelchair up a ramp, press a button on automatic doors, pick up dropped items, and even bring objects such as a ringing phone to the owner. For people with epilepsy, a service dog can alert the owner before a seizure occurs and remain close during a seizure to prevent injury. For veterans with PTSD, a service dog can interrupt its owner when suffering from an episode by nudging, bringing medication, or even putting the owner in a crowded area to create personal space. The 10 do's and don'ts of behavior around a service dog team. This was actually recommended to me by a student who has been having some issues with her service dog on campus. First of all, do speak to the owner and handler rather than the dog. Don't touch the dog without asking permission first. Do keep pet dogs a distance away from a working dog. Don't offer food to a service dog. Do treat the owner handler with sensitivity and respect. Don't assume a napping service dog is off duty. Do inform the handler if a service dog approaches you. Don't do anything to distract the dog from its job. Do ask before acting if there's ways you can assist. And don't assume that the person does not have a disability just because you can't see one. I wanted also to just give you a heads up about the accessibility website, which is a great resource for information, everything related to disability and it's accessibility.umd.edu. There's a lot of information about accommodations and the process for students, faculty, and staff, technology, and how to make your courses accessible, events and classes. And we have a whole list of resources for faculty about making your classes accessible. Access, physical access, transportation, visitors to campus, emergency preparedness, policies we have on campus related to disability, campus areas such as arts and entertainment, university libraries, and athletics, and their disability policies, and then other resources that may be helpful. Now I'm going to turn it over to Tessa, who's going to talk about accessibility and disability services.
Thanks, Emily. The Accessibility and Disability Service Office, or ADS as we're known on this campus, is the primary area where students would disclose their disability status, and through an interactive process, we would determine disability-based accommodations for them. My office works with students in all capacities of their time here. So whether that be in academics or housing, being a Research One institution, we also work with folks through their PhD program, whether they have a teaching assistantship or a research-based assistantship. And we even work with folks if they are employed as a student worker in various departments across campus. Okay. So ultimately, through the lens of what we do through the interactive process, we determine reasonable accommodations. And Emily has already set a foundation of what a reasonable accommodation is. But ultimately, what I want everyone to take away from is when ADS determines a reasonable accommodation, we are first and foremost looking at the functional limitations of that disability. But we also interact with faculty, departments, and if you think of yourself as an employer in the student worker context, of determining what are the fundamental elements or essential elements, as Emily talked about, of what is required. And so if at any point in time you receive an accommodation letter and you question the reasonableness of what's listed, we want you to engage with my office so we can have a conversation about that. So remember, whenever you see something listed on the letter, if you have any questions or concerns, please call us. And so the other piece about reasonable accommodations I want to highlight here is that in terms of when accommodations are applied and how they're applied, is ultimately that there is no formal deadline for students to apply to use their accommodations. So we have folks who are super proactive who connect with us prior to the start of a semester or prior to the start of a job. But we also have folks who, for whatever reason, delay that process. And so whenever a student shares their accommodation letter with you, it's really from that point forward that we would begin implementing things. I'll have Emily go to the next slide. So ultimately, what I have done in outlining this presentation for you today, I thought it would be very helpful to kind of split up the responsibilities to give some targeted guidance for you as an instructor or supervisor to know what should you expect in terms of your responsibilities versus the student. So ultimately, in the student realm, it is their responsibility to disclose to you that they have a disability and that they're registered with ADS and have formal accommodations. In that conversation, they should provide you what we refer to as an accommodation letter. And we've designed these letters to list the current semester at the top. So by visually looking at the letter, you won't know what the disability is, but you can see is the accommodation valid for the period that they're giving you that letter. On the realm of your role as an instructor or supervisor, you will never have, whether you're looking at an attendance list or any other employee-based tracker, there will never be a star, flag, or indicator to let you know in advance who's connected with my office. So what I encourage everyone to do is to create some form of welcoming environment so that folks know that they can come to you and have a private conversation to discuss the logistics of their accommodation needs. Now, I know in the wide variety of roles that a faculty member, advisor, or supervisor takes on, you will often work with folks on a spectrum where some folks feel very comfortable sharing their whole life story with you, whereas other folks are more private and reserved. One of the most important things of engaging in this process and having these conversations is to know that any information that is shared should remain confidential. But then also, as you're engaging in those dialogues, the questions that you should be discussing should all focus and tie back to the logistics of using the accommodation and not really get into anything about the explanation of what their disability is, the symptoms that they experience. It should really be focused on the logistics of implementing those accommodations. And I'll have Emily go to the next slide. Okay. So just some broad helpful information for you to know about ADS and how we operate. One is that when it comes to working with students, they are actually not required to disclose their disability or use their accommodations. So as I mentioned before about the retroactive piece, it really is at the student's discretion when they decide to disclose and use their accommodations, which may be a surprise for some. In terms of the working relationship of and kind of how my office operates, it's also really important to know that we utilize kind of a case model within our office. So every student who works with us has an assigned point of contact, and we encourage you as faculty to engage with that person if you have any of those specific questions or concerns, or if a student discloses to you that they're having difficulty using their accommodations, or maybe they imply they want to make a change, encourage them to reach back out to that point of contact. ADS, due to the nature of the work that we do and the staffing that we have, at this point in time, we don't have the ability to do drop-in hours, but students can schedule an appointment to connect with us, whether they've spoken with us and worked with us for years or they're very recently connected. So any way that you can refer folks back to us and encourage them to continue to work with us is always appreciated. Okay, and I'll have Emily go to the next slide here. On this slide, I have two images. On the left-hand side of my left is a copy of the accommodation letter. And ultimately, this is just to kind of give you an idea of what does this document look like. At the top in red, we have two arrows highlighting where the current semester would be listed on the letter. And then as we look down, that letter will identify the name and UID of the student. And then we separate all of their accommodations kind of in the middle of that letter with the larger arrow, breaking down accommodations by testing, classroom, and a variety of other categories. On the right-hand side, we have what's known as a student acknowledgement of request form. And ultimately, I'll have you think of this as a receipt. This document is not required, but it is encouraged for our students to have you as an instructor sign. And ultimately what this would do is have a record of at what point in the semester did you have a conversation related to the logistics of implementing any of the accommodations. Okay, and I'll have Emily go to the next slide. So now that I've kind of given a foundation of ADS, our staffing structure, and what I'm now going to do is talk about some targeted guidance for you based on the most common pockets of accommodations that we're seeing within my office. So I'll have Emily go to the next slide. So to start off foundationally, I'll have all of you know that we utilize an online portal system, and we receive a data feed from the registrar that highlights the student's name, UID, the courses they're enrolled in, and who is the primary instructor of record. And so ultimately, this system is what both students and you yourself as faculty members would use to obtain a copy of the accommodation letter that I previously shown. But ultimately, this online portal system is, in a manner of speaking, kind of like a one-stop shop for students to share accommodation letters with you. On the faculty side, you can upload testing information, and students can utilize it also for testing and a variety of note-taking accommodations as well. The direct link to that is just adsonline.umd.edu. So I'll have Emily go to the next one here. So the most common accommodation that we see in my office are testing-based accommodations. And here at the University of Maryland, there are really two primary methods of how we implement testing accommodations. The first method is really where you as the instructor make arrangements personally with the students in your class. There's a variety of ways that this can be accomplished. And I'm just going to speak to some of them, but this is not an exhaustive list by any means. But ultimately, faculty can utilize technology such as using Canvas to program additional time within online assessments. But many faculty members also work out with the students to either use the classroom itself, classroom building, or a location within the department where a decision is made to show up either early or stay a little bit later to have the instructor give extra time in a location that works for them. Now, on the other side, there is an accommodated testing office that is run and managed by ADS. This requires that students make a reservation indicating that they're going to anticipate being with us on a particular day and time. As an instructor, you have the ability to see what those reservations are, and you actually confirm to my office, is that starting time and the date appropriate. Obviously, we can't administer an exam without a copy. So as an instructor, you would use that online portal system to give us a copy of the exam and provide the directional information. Ultimately, due to the volume of exams that we administer within our accommodated testing office, we do require advance notice both from the student. And so currently students make a reservation at minimum of a week in advance. And as a faculty member, we ask that you provide us a blank copy of the exam and the directional information at least by noon the day before. And just to give some context, as of the time Emily and I are doing this presentation, we are administering approximately 10,000 exams within an academic year. So I'll have Emily go to the next one. So the next pocket of accommodations that is used quite frequently is related to note-taking and needing supplemental note-taking support. And again, I've broken this down into the two primary ways that that's addressed here on this campus. One being technology-based solution. And again, this is not an exhaustive list, but for some students, they utilize technology where they can either fill in the gaps of their notes personally, or they're using it as a way to either keep pace in the moment or be able to enlarge and see the information in real time with you. On the other hand, when we think of note-taking, it very often triggers a thought for folks known as a peer note-taking system, where you have multiple students sharing their notes together. And over time, we have transitioned from using carbon copy paper, and now we utilize things like Google Docs. I've seen some really creative ways students do that using GroupMe. But ultimately, in either case of using note-taking accommodations, your role as a faculty member would be to engage with ADS and the student to help either recruit a peer note-taker and or coordinate with us so we can implement some of those technology-based systems in the classroom. Okay. Here at Maryland, in sign language interpreters, transcribers, and captioning for videos is used quite prevalently. And I believe it's due to our close proximity to DC and Gallaudet University that is there. But ultimately, if and when there is a student with a hearing loss in your class, my office will proactively contact you and engage with you on if a service provider like an American Sign Language interpreter will be in your classroom, or if it's really related to having someone in need of captioning. I'm sure all of us can think to a time in our lives where, whether we're at the airport or at a restaurant and you can see captions on the TV, or even think of YouTube videos. Automated captioning is starting to become just embedded into our daily life, but I want everyone to be aware that those automatic captions may not be accurate. So it is not the same turning on the button on a YouTube video than to have it professionally captioned by someone in my office. And so just know that if you ever have a question of, is this an appropriate way to ensure communication access, please contact us. But also know that we will engage with you as soon as we're aware that a student's enrolled in your class to try and get, if not everything, majority of your materials captioned earlier in the semester, so then you can just continue on with your plan of instruction without having to make changes along the way. Okay. Similarly, alternate format of text materials is something that my office would coordinate directly with you as a faculty member. Alternate format could mean a variety of different things depending on the disability. That could be brailled materials, something that's enlarged, or even just getting an audio version of a handout or textbook. So ultimately, just for your own information, our office coordinates with accessible textbook programs, and even within McKeldin Library, there is a great team in-house on campus that we partner with to be able to get alternate format of materials. And so ultimately know that the earlier we can know what is your reading list, we can work to convert materials in the order in which you're going to cover that information in your class. So if you're covering chapter 10 before you're going to cover chapter 7, we'll convert it in that order. So if you're curious at all about the work that we do converting textbooks, we are located over in McKeldin Library, is where that work happens. But ultimately, you would never be responsible for coordinating any of the conversion yourself. Okay. Extended due dates and periodic absence accommodations are also another way to think of them. Are flexibility-based accommodations are something that are becoming more and more prevalent in college students today. It really is amazing the level of coordination that students today need to think through. And so with that, we acknowledge that every course that happens on this campus, the modality, what logistics are involved in group work or discussions or things are vary course to course and even within a department. So ultimately, my office has created a process known as a detailed implementation plan, where we create a personalized, essentially a contract outlining what degree of flexibility does a student have in the context of that particular course. And if anything, I just want to encourage all of you to contact my office so we can help determine the specific logistics of how these two flexibility-based accommodations would apply for your particular course. Okay. The last thing I'm going to spend some time talking about today is really your role in the referral and or consultation process. So in terms of referring students to my office, I want you all to know that you should absolutely contact us at any point in time that you either have a concern about an accommodation related to how does this work in my class, but also just consulting with us about, I'm concerned about a student. It is always important that you don't assume that someone has a disability. They could just be struggling in their transition of being a college student. And if you think of college readiness, but we are more than happy to help have those conversations with you and to help identify, if it's not us, what other types of appropriate referrals could help that student. So think of anything from tutoring, the writing center, counseling service is another great resource. And I also want to just let all of you know as well that the counseling service also has a warm line that can be used. So if there are any behavioral concerns related to a student, they're also a wonderful resource for you to have as well. And in terms of added support for your role as a instructor or departments, we have an entire section of our website dedicated to this information. So please feel free to look, but if you read anything there, it's not clear, or this presentation has triggered some questions that you want to dive in more deeper, please call or email the ADS front desk and request to speak with one of my disability specialists, and we'll be more than happy to have a longer, more in-depth conversation with you. And so one of the last things on our presentation today, Emily and I wanted to review and kind of highlight some of these 7 steps to help promote inclusive learning or inclusive learning environment. So I'm going to turn it over to Emily just to end on some additional resources for you to take away from today's presentation.
Thanks, Tessa. So as Tessa mentioned, we just wanted to end on a couple things to just give you some takeaways from our presentation today. So 7 steps to help promote an inclusive learning environment, because that is what we're really trying to do. Not just provide accommodations to separate people out, but to make sure that everything we're doing is inclusive of everybody so that we don't have to necessarily provide accommodations. And so first off, the TLTC website provides a model with a syllabus template that I really encourage you to use when you're building your syllabus, that includes accessible language and other information about ensuring that we're providing accommodations. Then the other thing is to make sure that your course, when viewed in its entirety, is accessible. So that includes content, texts, materials, assessment methods, online instructions, time requirements. And again, the IT accessibility website has many resources available for making your course content accessible. And there's additional resources and information about implementing accommodations for students with disabilities that can be found on the Teaching Resources on Disabilities page on ODI's website, which is the accessibility site that I mentioned before. And then you also finally want to ensure that all materials posted in your ELMS account are in an accessible format. And the IT accessibility website has information on ensuring that the information you're putting on ELMS is how you make it accessible. And then finally, you want to consider how traditional approaches to teaching, i.e., so if you only provide a paper test or you show a video without captions, may create barriers and proactively remove them. So you can use the course accessibility checklist, to ensure your course is accessible to all. And again, that's on the IT accessibility website. Just as an example for that, what I'm saying is in terms of providing a paper test, there are multiple modalities you can provide a test, and a paper test isn't always going to work for everybody, right? If somebody is blind or low vision. So you want to try and provide what works for everybody without making an alternative solution just for one person. And then the last 3 steps to our 7 steps are: ensure that recorded classes are captioned before posting to ensure equal access. And again, you can look at the DIT guidance on how to caption videos. If you do a course on Zoom and you include the captioning, that doesn't necessarily get included in post-production. So you want to make sure to include post-production captioning. Remember that it may sometimes be hard for students to request what they need. So be patient. Talk with the student, consult with ADS or the ADA coordinator, and take an active role in ensuring reasonable accommodations. One of the most essential things and easiest things that all of us can do is have a conversation with the student. When you get that accommodation letter from the ADS office, set up a time to talk with the student, go through their accommodations, ask them questions. Don't feel afraid to ask them, because that you're really showing that you want to take an active role and be a part of this process with them, to be a strong advocate on their behalf. But the only way you can do that is if you have a conversation. You're not asking them to disclose about their disability. They don't need to do that, but you're asking them what you can do to best help. And so that's really what we need to do. Always maintain confidentiality regarding accommodations, and remember that students are not required to disclose their diagnosis to the faculty, like I just said. If a student does disclose a diagnosis, this is information that is to be treated as confidential under the protections of FERPA and not to be shared with other faculty or students. So again, please be careful when talking with other faculty not to share information about students with disabilities in particular. So those are just 7 things that we wanted to share with you as sort of takeaways for this. This is our contact information. Mine is up first, and then Tessa's is last. It's the general information for both of our offices. If you need to reach somebody, this is the easiest way to do it. Tessa, any final thoughts?
Thank you for spending some time with us, and don't hesitate to reach out to either Emily's office or ADS so we can help provide that specific targeted guidance.
Thank you all very much, and please feel free to reach out to us at any time. Have a great rest of your day.